Welcome to the Banega Swasth India podcast. Our focus is on creating a holistic and healthy India for each and everyone. Our goal is Lakshya Sampurna Swasthika, where citizens, individuals, society and governments work together to ensure health for all. Health for all is a goal that is the core of both the World Health Organization and the United Nations Sustainable Development Goal SDG 3, reinforced by 16 other SDGs to be attained by 2030. The theme for World Health Day 2023 is Health for All, everyone, everywhere attaining the highest level of health and well-being. And when we talk about health, we cannot ignore maternal health, the foundation of a child's health and well-being. To discuss the same, NDTV's Megha Prasad spoke to Smriti Irani, Union Minister for Women and Child Development. I'm Ambika Singh Kama, and I will be taking you through the excerpts of the interview. The infant mortality rate in India has reduced from 37 per 1,000 live births in 2015 to 30 per 1,000 live births in 2019. Similarly, the maternal mortality rate has reduced from 130 per lakh live births in 2014-2016 to 97 per lakh live births in 2018-2020 at the national level. While we have made progress, how do we ensure even better facilities for mothers and infants? Here is what Ms. Irani said.
That there is a cyclic impact on a child's health which generates for how healthy a woman is, the mother giving birth. It also has a contribution of the father's health and the genetic predisposition a child has towards a healthy future. That recognition needs to happen. And that is why what is the cyclic impact the government is unleashing? First, let's begin with sanitation. Not many people know that good health is dependent on access to good sanitation facilities. Washing of hands, you need access to clean water. So if you look at the Jal Jeevan mission and the Prime Minister's agenda of ensuring every home has tapped water, that is an initiative that is equally based in health as much as it is based in access to clean drinking water. The second issue is access to clean toilets. Prime Minister has built 110 million individual household toilets in the past 8 to 9 years. And when you have an open defecation policy literally supported by an administration which does not look at this very basic need of the citizen, which happened in the UPA era, that is when you perpetuate or propagate illnesses and sickness within a family confine. And that is why the second intervention, which is the building of the toilets, is equally important for a healthy living circumstance for a woman, child, or the family at large. The third is access to nutrition. In the past 2.5 years, the Prime Minister has ensured that 800 million Indians get access to free food, free ration, for which money is spent by the Government of India alone. It's from the National Treasury. And the doorstep delivery of the same is also accompanied by additional nutrition support for pregnant, lactating women and children under the age of 6. I think that additional nutrition support is also intended to ensure that the day-to-day struggle of ensuring that all mouths are fed is a struggle in which the government can be of support to our citizens. Fourthly is the access to affordable medication. Now we have over 9,000 plus Jan Aushadhi Kendras in the country, which in fact have 40 products particularly highlighted only for women. Menstrual health included and hygiene included. One of them is the 1 rupee sanitary pad that the Honorable Prime Minister spoke about. So I think that on these 4 levels, nutrition, clean water, sanitation facilities, access to affordable medicine, the government has done much. Infrastructurally, the government has also ensured that over 1 lakh plus wellness centers open up in the country. Infrastructurally, now every district in our country will have a medical college. Infrastructurally, the number of AIIMS have literally gone up. But apart from that, the infrastructural support needed for district hospitals, PHC, CSCs, is also something that the government has afforded much fiscal support to. So I think that we can't be myopic enough to look at MMR or, for that matter, children's or infants' mortality from only that one perspective.
Okay.
For instance, we run in the Ministry of Women and Child Department the Poshan Abhiyan, which is the Prime Minister's flagship scheme for nutrition for pregnant, lactating women and children under the age of 6. We don't run it alone. It's an amalgam of 18 ministries.
Okay.
Which includes Sports Ministry, which includes Rural Development Ministry, which includes Urban Development Ministry, which includes Jal Shakti, which includes even agriculture.
Okay.
So it's not an effort of one department alone. It's a combined governmental initiative, which we ensure percolates on the ground with the support, because ultimately the basic infrastructure lies with the state governments.
Banega Swasth India podcast will be back after a short break.
Watch out for the Banega Swasth India video podcast Swasthya Mantra, the first ever health and hygiene podcast. It's launching on 5th of May, that's World Hand Hygiene Day, on Spotify, Apple and YouTube in English and in Hindi.
Welcome back to Banega Swasth India podcast. Malnutrition still remains a huge challenge for our country. Union Minister Smriti Irani explains why.
Because it's an intra-generational challenge.
Yeah,
it is not a challenge only limited to feeding a child.
Yeah.
So many of us presume that, let's say I'm a hefty, well-built woman, I cannot be anemic, which is a fallacy.
Well, most of us are anemic.
Yes. So, and again, anemia is looked upon as a poor man's disease or a poor woman's disease. That is not so.
Yeah.
So, if we are looking, let's say, of nutritional parameters which pose a challenge to us, why is it that challenge exists? For instance, the government now has a program for adolescent young girls in aspirational districts. Why were aspirational districts so ordained? Because issues of nutrition and education for young women, children was a challenge. And that is why the Prime Minister carved out aspirational district to say, can we converge and combine all our efforts to ensure these parameters are well positioned now in those districts. He has now ensured that he goes to the detail of even having aspirational blocks to say, for instance, Amethi, the district Amethi is not an aspirational district, but I have 3 aspirational blocks.
Now coming to one of the UN campaigns, which is WASH, that is Water, Sanitation and Hygiene. What is the status of this campaign in India? Listen to Ms. Irani.
But let's dial back and look at our own families. Look at our elders, look at our parents. What did mom say every time you sat down to eat? Haath dhoya kya? Correct? What did dada, dadi, nana, nani say? Chacha, chachi, mama, mummy, mausi, bua. What did they all say every time you tried to eat something? Haath dho ke khao. So while the UN agencies, and I appreciate their efforts, calls it WASH, look home.
We were already doing it?
Wasn't every elder in your family saying it?
Yeah. Part of our culture, I would say.
It is. I'm happy it's labelled now, but it was genuinely a way of life for all of us. Teachers tell you that, but predominantly it's a culture at home.
That's it on the Banega Swasth India podcast this week. If you have comments, queries or suggestions on the topic we discussed today or issues you would like us to cover in future, do write to us on bsipodcast@ndtv.com. Remember, BSI stands for Banega Swasth India. You can also connect with us on Banega Swasth India handles on Facebook, Twitter and Instagram and continue the conversation through the week. Till next week, this is Ambika Singh Kama signing off. Stay healthy and stay safe.